Upon arrival, you will be screened by one of our staff members, which includes temperature being taken. If you have any of the following symptoms, you will not be allowed into the facility. Temperature of 100.4 or chills, new or change in cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea, exposure to facilities with COVID-19 cases. Once you're approved for the screening process, you will be provided with an N95 mask, and you will need to sanitize your hands. Steps for sanitizing hands. Apply hand sanitizer. Vigorously rub all surfaces of hands, fingers, wrist for a minimum of 20 seconds or until dry. Do not wave or shake hands in an attempt to dry. Immediately after sanitizing hands, unfold respirator and hold it with both hands, with metallic strip facing up. Place the respirator against your face, pull the bottom elastic band around the nape of the neck and the top elastic band on your head, respectively above the ears. Place the mask against your face, covering both your nose and mouth. Adjust the metallic strip cover over the bridge of your nose using 2 fingers to press down until achieving a close fit. Ensure the respirator is covering both your nose and mouth. Place both hands over the mask. Take a deep breath and hold your breath for a few seconds, making sure the mask collapses inwards as you inhale. If air leaks, follow steps 1 through 3 again. Do not touch the outside of the respirator after application, as that will contaminate it. Facial hair or other facial features may prevent the mask from achieving a proper fit. Steps for hand washing. Turn on hot and cold water to a warm, tolerable temperature, making sure you do not lean on the counter. Wet both hands without shaking. Apply soap. Rub hands vigorously, covering the palms, back of hands, wrists, between fingers for a minimum of 20 seconds. Count to 30 or sing the happy birthday song twice, and rub fingernails, alternating palms last. Rinse hands without shaking. Shaking increases risk of contamination. Dry one hand at a time. Turn off your water, utilizing paper towels, 1 per each handle. Donning or applying PPE. Note that the N95 respirator was previously applied upon initial screening when entering the building. Items needed are hand sanitizer, isolation gown, mask, face shield or goggles, and gloves. Apply the isolation gown. Making sure all ties are tied on the gown. Please ask for assistance if you cannot do so properly. Ensure to place thumbs in thumb holes if your gown has them. Put on your face shield or goggles using only the straps. Put on gloves, making sure to cover the cuff of the gown. Doffing or removing PPE. Remove the first glove by pulling it off from the center. Hold it in the gloved hand. Use 2 fingers from the glove-free hand. Place them under the other cuff and remove the gloves and discard. Removing the gown. Untie all ties. Some can be gently broken. Do not use forceful movement. Reach up to the shoulders and carefully pull and roll the gown down and away from the body. Be careful not to touch the outside of the gown and dispose of properly. Perform hand hygiene by washing or sanitizing as instructed previously. Removing the face shield or goggles by grabbing the strap and pulling upwards and away from the head without touching the front of the face shield or goggles and dispose of properly. Bend over slightly at the waist and remove N95 respirator by grasping the bottom strap from the nape of the neck, bringing it carefully overhead. Then grasp the top strap, carefully pulling it over the head and away from the body. Dispose of properly without touching the outside of the mask. Wash and sanitize as instructed above. COVID-19 attestation of action for visitation. We are pleased to begin the process of reopening our facility and happy to welcome loved ones in once again for visits. We will be going over the requirements for essential caregiver visitations, and we ask that you review the requirements and select the appropriate response. Given the nature of COVID-19, you understand that there is a risk of being exposed while visiting the facility by virtue of the type of patients, care, and services provided at the facility. Regardless of the facility efforts, you understand that the facility cannot prevent COVID-19 exposure while you're in the facility. You further understand that exposure to COVID-19 can be detrimental to your health, with risks including but not limited to infection, hospitalization, short and long-term health complications, including death. Acknowledging these risks, if you still wish to proceed with the facility visits, you will monitor for signs and symptoms of COVID-19 after your visitation. In order to ensure the safety of our residents and continue to comply with local, state, and federal regulations, please review and sign the following attestations. You understand there are requirements related to testing for COVID-19 in order to engage in an essential caregiver visit that includes, but not limited to, the following. You will allow or have allowed the facility to administer a COVID test and maintain proof of results for facility records. You will allow the facility staff to administer a COVID test prior to entry, wait for results, and only enter after a negative result is returned. You will not enter the facility or facility grounds if you've had a positive COVID test within the prior 10 days or until fully recovered, whichever is longer. All salon service providers must attest that they will comply with the most current version of the minimum standard health protocols checklist for cosmetology salons located at www.open.texas.gov. You attest that prior to visitation, you received and understand the instructions from the facility and will strictly adhere to facility and staff instructions at all times while in the facility or on facility grounds in regards to the following: proper PPE usage, including face masks, hand hygiene, performance and frequency, respiratory hygiene, cough and sneeze etiquette, refraining from contact with and maintaining proper social distance of at least 6 feet from all staff, residents, or other persons in the facility for whom you are not a designated essential caregiver. You understand that visitation is limited to 1 essential caregiver per resident at any given time. You understand that you will not be allowed to visit if the resident designated for visitation is COVID positive. You agree to abide by all applicable local, state, federal, and facility guidelines, including but not limited to the following. You understand that you must schedule all visits in advance and arrive at least 30 minutes prior to allow time for screening and testing. If unable to arrive 30 minutes prior to visit, it may be canceled or rescheduled. Visit by appointment only and comply with necessary changes as instructed by facility staff. Adhere to the time allotted for each visit by the facility and comply with necessary changes as instructed by facility staff. Use only the designated entry or exit as instructed by facility unless an emergency evacuation is required. Present a valid ID and allow facility staff to confirm your identity prior to entry. Receive and wear an essential caregiver badge at all times while in facility or on facility grounds. At each entry, submit to screening, including but not limited to demonstration of temperature of 100.4 Fahrenheit or less, have no signs of symptoms of COVID-19, including chills, cough, shortness of breath, difficult breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting or diarrhea, or any additional signs and symptoms as defined by CDC. If you demonstrate any of the above, you will not enter the facility and will seek advice of a medical professional. At each entry, attest that you have not had contact in the last 14 days with someone who has confirmed diagnosis of COVID-19, is under investigation for COVID-19, or is ill with respiratory illness. Traveled outside the United States in the last 14 days. If you are unable to attest to any of the above, you will not enter the facility. Limit movement in the facility to spaces designated for visitation and adhere to the staff's instructions of movement in the facility at all times. Be escorted by facility staff to and from the designated visitation location and not leave the designated location during the visit. Self-monitor for any signs or symptoms of COVID-19 while in the facility or on facility grounds. Inform facility staff immediately. Do not interact with any other person. Follow instructions to immediately exit facility. Notify your healthcare provider and follow their instructions. Agree to immediately notify facility of any new onset of signs or symptoms, exposure to or positive test for COVID-19 within 14 days of any visit to the facility or facility grounds. You understand that if for any reason you are unable to do or not comply with all of the local, state, federal, and facility instructions in regards to visitation, you will be denied entry until you're able to demonstrate compliance. By signing below, you attest that you have received all above referenced information and trainings. You have and will faithfully and to the best of your ability follow all rules and regulations as set forth, and will provide true and current information to the facility regarding visitation rules and regulations.